Thank you for joining us at AskTheseDoctors.com. We're here to help make your healthcare affordable. You can visit us on the web at www.AskTheseDoctors.com, or you can download our videos at www.shop.AskTheseDoctors.com. This week we're talking about pink eye. Pink eye is known as conjunctivitis in medical terms. The conjunctiva is a thin film over the front of the eye. This goes all the way up to the iris, which is the colored part of the eye, and it lines the inside of the eyelids. It's transparent unless it's inflamed. Once that happens, it becomes opaque, whitish yellow, or even fleshy in appearance. The most common causes of red eye and discharge is pink eye or acute conjunctivitis. Pink eye is inflammation of the conjunctiva. This might result in a pink or red color from inflammation of blood vessels. A severely painful red eye, or if there's any change in vision, this may not be conjunctivitis or pink eye. If this is the case, you need to see your eye doctor promptly. Bacterial conjunctivitis, it's spread by direct contact with contaminated surfaces or with people who have this disease. It's highly contagious. It may involve one or both eyes. Symptoms include redness and discharge. The discharge persists all day. This helps differentiate bacterial causes from other causes. The discharge is usually thick, globular, and sticky. It may be yellow, whitish, or green. This is a classic example of bacterial conjunctivitis. Redness of the white part of the eye, yellow crust in the lashes, some mild redness around the eye, some mild swelling. Viral conjunctivitis, this is probably the most common cause of pink eye. Adenoviruses are the most common cause of viral conjunctivitis. This same family of viruses causes the common cold. Patients may experience fever, sore throat, runny nose, or typical cough and cold symptoms. This too is highly contagious. It's spread by direct contact with persons, their secretions, or any surface or object that's contaminated by these secretions. Symptoms include redness, injection, watery discharge, a sensation of sandiness or grittiness, and a burning feeling. There may be slight crust in the morning, but this usually goes away once the eyelids are washed. It usually involves both eyes by 24 to 48 hours into this illness. The insides of the eyelids look bumpy and inflamed. A swollen gland in front of the ear is a tip-off that the most common cause of this is a virus. This is a classic picture of viral conjunctivitis. A little bit of redness, not a lot of discharge, there's no blisters or bumps around the eye, no significant swelling, the colored part of the eye remains clear. Viral conjunctivitis is self-limited. That means it's going to go away on its own no matter what you do. It may get worse initially over the first 3 to 5 days, but usually completely resolves over the course of 1 to 2 weeks, right along with the cold symptoms that typically go along with this. There is, however, one important exception. Epidemic keratoconjunctivitis, a fancy word which just means a particularly highly contagious form of severe viral pink eye. Epidemic keratoconjunctivitis is a virus that causes keratitis. Keratitis results in inflammation in the front part of the eye over the cornea. The tip-off that this is the cause is that there will be a severe foreign body sensation, often to the point of not even being able to open your eyes. Vision is often decreased to 20/40 or worse. There's some discharge. This is a potentially vision-threatening condition. In this setting, you need to see your eye doctor promptly. If untreated, it can result in scarring over the cornea, which will impair your vision. Allergic conjunctivitis is caused by allergens which get in contact with the eye. Very common in spring, summer, and fall. It results in histamine release, just like for allergies, asthma, and hay fever. Symptoms include both eyes being red, watery discharge, and the key here is itching. The insides of the lids may also be red and bumpy. Chemosis is a medical definition for severe swelling of the conjunctiva. This can be severe and extend beyond the margins of the lids. This is a picture of severe chemosis. Note how it looks almost jelly-like, that the white part of the eye is inflamed and extends outward. This is almost invariably caused by an allergic process. Treatment for all types of conjunctivitis or pink eye include warm compresses and lid hygiene. Keep the eyelids clean. You may need to use some mild soap such as baby shampoo. Hand washing is key to prevent it from spreading to other people in your family, workplace, and school. If a bacterial cause is suspected or diagnosed by your doctor, antibiotics will be prescribed. It can either be in drop form or ointment. Both work well. Ointments work well in children but can be a bit of a challenge to get in. If there's intense itching, antihistamines are often recommended. They come in tablet or pill form, and also antihistamine eye drops, which can help treat the symptoms. There are also anti-inflammatory eye drops that your doctor may prescribe in severe cases. Bacterial conjunctivitis usually responds to antibiotic drops within a few days. If it doesn't, if there's worsening symptoms, no response, or this is key, if there's any vision change at all, you need to be evaluated by an eye doctor promptly. The most common controversy with conjunctivitis is when to return to work or school. It's really best to avoid others until discharge is gone, but in reality that's not practical. Most viral colds and causes of pink eye may last a week or more. Who can afford to miss work for that long? Daycare and schools often require antibiotics. Often we're treating the school nurse or the school administrator as opposed to the patient. If a bacterial cause, it'll respond to antibiotics. It'll reduce transmission. In this setting, antibiotics are beneficial. If it's a viral cause, the antibiotics do nothing, and they don't help allergic causes either. It's just a waste of your money. Extra precautions are needed if you're going to be in contact with the ill, elderly patients, or anybody who is potentially immune compromised. The best recommendation we can suggest is to consider that their problem of pink eye is just like a cold, and the decision to return to work or school should be similar to one that you would make in that same situation. Again, those who have contact with the very old, the very young, anybody who's immune compromised should take care to avoid the spread of infection from their eye secretions to these very susceptible people. Red flags. Warning signs that something more serious is going on include the following: decreased vision or visual acuity, an intense ring of redness which is just around the iris or the colored part of the eye, light sensitivity, particularly if it's severe, a severe foreign body sensation, often which results in the inability to open the eye, a cloudy or steamy cornea, a pupil that does not respond when light is shown into it, or a severe headache. Any of these should prompt evaluation by a medical doctor or an eye doctor. They tip off that there's something more serious going on. This slide reviews a few of the common presentations of the different types of pink eye. The viral kind with a little bit of redness, not a lot of discharge, and not a lot of crusting or mattering. The middle column shows bacterial, thick drainage, a little bit more swelling, and a lot more inflammation. And the last column shows allergic. You can see the swelling over the eyes, itching, sneezing, and the classic example of chemosis. As you've seen in this presentation, we've discussed the different types of conjunctivitis, treatment options. We've talked about red flags that should prompt you to get in immediately to see your doctor or your eye doctor. And we've also discussed the issue around returning to work and school. Please visit us at www.askthesedoctors.com. Download our videos at www.shopaskthesedoctors.com. We can also find us on Facebook, Blogger, and one of our editors has posted some videos on YouTube. Thank you.